MERS has a provision where they will consider extending an amortization period. So we will be looking at that. We're already talking to MERS about what that process entails. I believe there is a provision for a one-time extension up to 30 years. Again, that would lower our annual ARC and help spread out the payments. If we close the DB plan, you heard the auditor say that it was a 15-year fix. I believe it's a 10-year fix, but we'll verify that. And we are currently asking MERS if that is extendable. But we could extend some of the closed plans that we have. And then the last strategy under spreading cost is considering bonding for the unfunded liability. Frankly, I'm not a big fan of this option, but I think all options are on the table, so we should look at it. But if you close your DB plan, and if your bond rating is sufficient, you can borrow for the unfunded liability. It gets rid of your liability immediately, and it spreads those payments, those ARC payments over time. That's the advantage. The disadvantage is you pay interest. You pay a significant amount of interest. But some communities have opted to do that. I provided an example in my report to the council. So it's an option, and we'll take a look at it. Moving to OPEB, under the objective of lowering costs, I'm recommending implementing and maintaining a uniform prescription drug and medical plan for all retirees. Based on the current employee plan, this would certainly be a change in philosophy for us. Currently, the city is obligated to provide prescription drug and medical insurance to retirees based on pay plans and collective bargaining agreements. However, those obligations do not specify the amount of the benefit. Our practice has always been to provide a level of benefit that a retiree received as an active employee. And that's where you get back to Anthony showed that we still have some folks on $3 prescription copays. But unfortunately, these rich plans are unsustainable due to their costs. And certainly, as council should know, staff has reviewed this with legal counsel, and we believe we're in a favorable position to, based on our documented policy and also recent case law, that we're able to implement this, although it may be challenged. Second item is really related to it. With current employees, we are under the hard cap under state law. We cannot offer a medical plan that is above certain caps that the state of Michigan establishes. And if they go above that cap, we have to reduce the benefit and adjust the cost. And I would recommend that if we implement this, that we do it for retirees as well as employees. Also, I want to note that our estimated annual savings for this strategy is $134,000 per year. Under increased funding, my recommendation is to put that savings towards the annual OPEB ARC. Also, I've recommended again the TIF pass-through, and then also identifying revenue growth and budget cuts to put towards the OPEB ARC. So, with these recommendations, staff has identified $700,000 in additional savings and funding towards our unfunded accrued liabilities. In terms of timing, these things, based on their nature, can't happen immediately. They have to happen over time. We will first look at closing the DB plan, opening a DC plan for new hires. We can do that mid-year if we choose to go that route. terms of employee contributions towards pension, that would occur as soon as July 1st of 2017 with a new pay plan for non-union and also any collective bargaining agreements that are coming due. We also plan to ask for reopeners on contracts, both for perhaps the DC plan and also, for the DC plan, we may ask for reopeners on that so that as we hire new people, they come under that new plan as soon as possible. Regarding OPEB, the health plan for retirees cannot be implemented until January 1 of 2018. That's based on our provider Humana's rules. Frankly, that will provide us time to meet with retirees if council decides to go this route, to meet with the retirees and also to allow them to plan for the additional costs in terms of additional co-pays and out-of-pocket and co-insurance. Increased funding toward OPEB, we'll start in January with the new budget, fiscal year 2018 budget, which is effective July 1st, 2017. So that's when we would implement the additional funding. Again, I noted in my report that if council is favorable on the strategies, that we would meet with our employees as well as retirees, and we actually go through this exact same presentation so that they understand the context. And then with regard to health insurance, we have somebody from our third-party administrator, Spectrum Benefits, come in and explain just what the current employee plan is and how it differs from whatever plan the retiree is on. And with that, I'll open up for questions.
All right. Thank you. Done.
Do any other municipalities deal outside of MERS?
Some municipalities have their very own pension plans with their own pension
We're
boards.
tied to MERS. Everything. Their longevity of our employees, everything. We're tied to these folks. We still have a lot of money sitting there. So I'm thinking, way outside here, but let's say we look at a bond that obviously not recommended, but let's say we look at that and instead of a $20 million bond issue, that we went to all the current beneficiaries of this plan and said, okay, we're going to get a $10 million bond, so we're going to buy all you folks out, like the other companies did. And like, we're bringing everyone in to saying, we're just going to continue with the same benefits. We're not asking for the retirees to ask to get reduced benefits. But yet we have this problem. New people, great. You're coming in and you've got your 401ks and I'm thinking, just a couple of things. I'm thinking, do we have to tie it to MERS? Can we offer our existing folks to say, come in and say, you know what, we're going to offer you $100,000 cash today, projected MERS thing of $400,000 or $500,000 if we cash you out now, and then get a bond to do that, where the interest wouldn't be as much as, I'm just floating stuff around and thinking that we're tied to this MERS thing, and it's kind of bugging me that we
Right, but what do you have to, I think I understand the concept, and we can certainly talk about that. But in terms of the level of benefit for the pension plan, those are contractual benefits, so they cannot change unless they're negotiated.
Unless they're renegotiated.
Yeah.
I'm just saying that we come to the table and we renegotiate, like all the auto companies did, and said, you have to get your own under Obamacare, you go to health care, you get your, your pension is worth this, but we'll offer you this today in cash. Are there other options out there other than just this? We seem to be awfully constrained. That's all.